Okay, today's video is in defense of the unvaccinated. They very well may not need my defense, but they get it anyway. It's a group that has been unfairly misrepresented for reasonable decisions. And here's why they're reasonable. If a boss hires an employee with a job description and that employee doesn't fulfill what's on the job description, that employee gets fired. The unvaccinated look over the last 30 to 40 years. They see the rise in chronic health conditions in children. They see the rise particularly in the neurodevelopmental disorders, and they fire the system that is overseeing it. Are they doing the right thing? Maybe, maybe not. But whatever it is, they're saying something is so off here that we are going to pick a different path. They hear stories of very reasonable parents that talk about their kids getting vaccinated and the lights going out. Is that exactly what happened? Is there something that's being conflated? Maybe, but very well, maybe not. And there is enough smoke that they are making the diagnosis of there's a fire, and so we are going to do something about that. And it would appear that, at least in the studies that I'll present today, that the outcomes are not worse. They do get some of the illnesses that vaccines help prevent, but there seems to be also some other benefits that they're seeing in their population that the vaccinated is not. So we're going to look at that. All right, here's an analogy. In the 1950s, there was increasing evidence that smoking was linked to cancer. But as of the 60s, still 1/3 of health professionals did not think smoking caused cancer. And when the study started coming out, the argument was, well, there's flaws in the study design. Sure, there is correlation between smoking and cancer, but correlation is not necessarily causation, and there's probably some other factor involved or something else that's going on that we just don't understand, until eventually everybody said, yeah, in this situation, correlation equals causation. Now, I'm sure there's other examples where correlation did not equal causation, but the unvaccinated cannot be vilified for saying, we believe there's enough correlation that we're making the diagnosis of fire. We are saying causation. Time will tell, but they are reasonable for the position that they are taking. Large vax versus unvax studies. My understanding of why they have not been done and why they're not going to get done. The leadership as it is now believes that it is immoral to do such a study because it means withholding vaccinations from a large number of children who will get diseases that could have otherwise been presented. So on morality alone, the study is not going to get done. You could then make an argument, well, there's still a lot of people that aren't vaccinated. Why don't we pick 100,000 of the unvaccinated and 100,000 of the vaccinated and just compare outcomes? But the response to that is, well, there's such different groups of people. There's other things that the unvaccinated families are likely to be doing that the vaccinated families are not. And so if we find a result, we can't say, oh, that is because of vaccination. Well, fair enough. But wouldn't it be helpful to know the final health outcomes? Maybe there's something the unvaccinated group is doing that's ultimately a better road, whether it's their lack of participant vaccination or not, that can be a signal to everybody else, this is the pathway to go down. So it would still be a very interesting, very reasonable study to have done. All right, 3 studies that I'll look at today with vaccinated versus unvaccinated children. First, a pilot comparative study of health of vaccinated and unvaccinated 6 to 12-year-old U.S. children. There were 666 participants. This was a survey-based study, meaning survey was sent to parents responded, and that's how the results were obtained. Certainly, there is more reliable ways to get results, but it is a start. in order to try to pick a similar population with vaccine versus not having a vaccine being the primary distinguishing factor, they picked all of homeschool children with an assumption that there is a lot of overlap in their lifestyles. All right, here's the results. Vaccinated children, as expected, had fewer chickenpox. 7.9% compared to 25% of the unvaccinated group. So the unvaccinated got a lot more chickenpox. That's to be expected. Same thing with pertussis, that's whooping cough. 8% of the unvaccinated got whooping cough, 2.5% of the vaccinated. So vaccines were effective in preventing some illness. However, vaccinated children had a 30 times greater odds of developing a diagnosis of allergies, 4 times greater odds of ADD, 4.2 times greater odds of autism, 2.9 times greater odds of eczema. This was even more, the difference between vaccinated and unvaccinated was even greater when it came to children who were preterm, where there was a 6.6 increased odds of neurodevelopmental disorders. And we'll see that same correlation at a later study. So the critique of the study was that the survey results were not verifiable. These weren't actual chart reviews where we could see medical diagnosis. We're just relying on the parents. Maybe the parents have reason to believe a certain way that's not actually accurate. Fair enough, but they were at least honest enough to say, yep, our child got more of the diseases that could have been prevented by vaccines. Why would we not assume they're honest in other ways as well? And at least I think we can say out of the study, you know what? There's some signal here. Maybe there's some smoke here. Next study, analysis of health outcomes in vaccinated and unvaccinated children, developmental delays, asthma, ear infections, and gastrointestinal disorders. For this study, they looked at children at 3 different pediatric offices in different areas of the United States. It was just a bit over 2,000 children. They did chart reviews, and they looked at children who had a vaccine prior to 1 year of age and those who did not. And so it's not vaxxed, unvaxxed, but it's along those lines. And here's the results. Vaccinated children were diagnosed with developmental delays at a 2.18 times greater odds, asthma at 4.5 greater odds, and 2.5 greater odds of ear infections and gastrointestinal disorder for the vaccinated group. One of the arguments against the validity of the outcome of the study was, well, these 2 population groups used the doctor's office at a different level or different rate. One group went, one group didn't. So you can't say, well, the vaccinated group had all these diagnosed with these other things more. The only reason the unvaccinated group didn't have that same outcome is because they weren't at the doctor's office. So to try to address this factor, they looked at visits for head injuries in each group, because being vaccinated or not makes no difference in whether you hit your head or not. And they were very similar. There was not a statistical difference in the number of visits they had for head injuries. So the argument then became, well, no, they weren't using the system at disproportionate rates. And so the results could be considered maybe reliable, maybe smoke. It's a small study. Might it be wrong? Sure. But it's certainly worth looking at, certainly worth considering. Okay, third study. This one's very large. Vaccinated and neurodevelopmental disorders in 9-year-old children enrolled in Medicaid. This is a study that comes out of Florida, and it had greater than 47,000 children enrolled. And here's the results. There was a relative risk of diagnosis with autism spectrum disorder that was increased according to the number of visits that included vaccinations. And children with 11 or more visits for vaccination were 4.4 times more likely to have been diagnosed with autism spectrum disorder. This really went up in the preborn and vaccinated, where 39% of them were diagnosed with at least one neurodevelopmental disorder, compared to 15% of preterm and unvaccinated. So is this study the study we were waiting on? As far as, by we, I mean the crowd and the unvaccinated camp. Does this prove that absolutely we are making the right decision? The critics would say, No. You again have a bias here that the children who are vaccinated are using the doctor's office a lot more. Their diagnoses, their conditions are being picked up and medically documented, and the unvaccinated are not. Okay. Sure. That's a possible reasonable explanation for the study results. But I will go back to what I was talking about earlier with the smoking studies in the 1950s, where the critique was correlation does not equal causation, and we can't associate smoking with bad outcomes yet. So, is vaccination status going to have a similar outcome years from now, where we look back and say, oh, what were we doing? I can't say for sure one way or another. But you know how we're going to know? It's because of people who are willing to stand up and take some heat, have some uncomfortable conversations at the doctor's office, have some painful conversations at school when they need to turn in their exemption forms, because they're going to be an example to the rest of society of going down a different path. Whether that ultimately ends up the right path or not, time will tell. But let's not vilify them for going down that path, because it's going to give us a signal, it's going to give us evidence, and my suspicion is it's ultimately going to be the path that will be normalized, or at least help create new norms when it comes to current medical policy around vaccinations. Or maybe it's just Tylenol. That was the recent, most of the listeners here are probably familiar with that press conference recently coming out of the White House. Maybe it's something else, but there's a group of people that's saying, we're not exactly sure what it is, but we are going to withdraw as much as we can and see if we can't get better outcomes. So if you're doing that, kudos, and it'll be very interesting to see what time tells in the end.